Neil, I'm so delighted to visit with you. You know, in the spirit of what we've begun to celebrate now, this 20-year experience in the Bluhm Cardiovascular Institute, it is about the people. And you are a foundational person. Your career has blossomed 50 years at one institution, and of your many crown jewels, in November to receive the Laennec Master Clinician Award from the American Heart Association, it's just such an emphatic punctuation mark on what we've tried to be and what our aspirations are here at the Bluhm Cardiovascular Institute. So congratulations, you are a master clinician.
Thanks.
Talk to me about that.
Thanks, Clyde. That's so kind of you. I've loved being a clinician all these years, and they've, except for my training years, have all been at Northwestern. I always felt very fortunate that I had such great role models. They started here at Northwestern when I was a student. Oglesby Paul, former president of the American Heart Association, what an extraordinary clinician and human being he was. And then I was at the Brigham and Women's Hospital, and I ran into Doctors Lou Dexter and Dr. Bernard Lown, and then Dr. Gorlin, who was the chief of cardiology there. And I was excited. I always tell people that here, I've been here 50 years and I forgot to burn out.
You know, I think about the names you just said. That's like, it's not exactly Mount Rushmore, but it's getting pretty close. Well, you got to put Bono up there, by the way.
Yeah, well, I actually did the first real stress test at the Brigham at Harvard because I had a patient who failed the master's two-step where they would go up and down two steps.
Yes.
I was so disappointed that they hadn't reached a high enough heart rate to show a problem that I went to Sears, and even though I was making $6,000 a year, paid $80 to get a stationary bike, set it up, got Dr. Gorlin's permission, and we began to do stress tests, getting people up to their maximal heart rate, and proved many people who didn't have heart disease did.
So not only did you spend time with these pioneers of cardiology, but you yourself were a pioneer with stress testing. So let's pivot from that illustrious, beautiful history that really describes your legacy as a clinician and as a bedside doctor. And just give us your view. You saw this Bluhm Cardiovascular Institute before anybody else could see it. You saw it at the very incipient stage, and look at where it is now.
Well, it all started with a conversation with Neil Bluhm.
And truly a magnanimous gift, just like you could imagine.
Before you know it, we had Pat McCarthy, who some of us were sending patients to begin with. We had Dr. Bono already, one of the great legends in cardiology, and then we got another legend in cardiology, Dr. Clyde Yancy, becomes the chief of cardiology. We just doubled down on this cardiology legacy with Don Lloyd Jones coming in preventive medicine, Charlie Davidson in the cath lab, and all of these people here were involved in national guidelines. We set the tone in cardiology for the rest of the country.
So thinking about your 50 years at this institution and where you are and your ability to look forward and see what's on the horizon, how do you see the future?
I always tell students, residents, and fellows who are going into cardiology, they couldn't be living in a more exciting time. There's a great quote, as the island of knowledge expands into the sea of ignorance, greater are the boundaries to the unknown.
That's beautiful.
And those boundaries to the unknown, that's the research. We want to make every day better than the next.
That's what got us to this point. Having those questions, many of which started at the bedside by great clinicians, great doctors, and now we have answers to those questions. I want to thank you for this conversation. I hope the listeners enjoy hearing this as much as I've enjoyed participating. Congratulations, Neil. Not just for the award, but congratulations for who you are as a person, as a physician. We can't thank you enough.
Thank you.